Hi guys, Dr. H here, your source of advanced musculoskeletal care, and today I want to do something a little bit different. I want to go over some common myths about the musculoskeletal system. Now some of these will be just downright untrue myths, while others of them might be true but need either updating or a little bit more explanation. So let's go ahead and do that. So the first myth I want to talk about is one of those just completely untrue myths, but you hear it all the time. That is, cracking your joints or cracking your knuckles can lead to arthritis, just like this. So I hear this one a lot because I do a technique called high velocity, low amplitude. It involves a fast movement and can sometimes make things crack and pop. And patients will sometimes worry that cracking their own necks or cracking their own knuckles can eventually lead to joint damage and arthritis. That has been completely debunked. They have studied this to death. I think it comes from a misunderstanding as to what's going on when you make that cracking sound with a joint. I'm going to do a completely separate video on that later on. Suffice it to say that the joint itself is not really involved in the cracking noise. It's more the space between the joint. And so cracking a joint won't degrade a joint, won't hurt a joint, won't lead to arthritis. So go ahead and crack your knuckles all you want. They're not going to become bigger, they're not become arthritic, they're not going to become painful. It's completely fine. So the next myth is not so much of a completely untrue thing, just something that needs a little bit more updating. And that is that the best way to treat an acute injury like a sprain or a strain is with R.I.C.E. I don't know if you're familiar with R.I.C.E, but R.I.C.E stands for rest, ice, compression, and elevation. So maybe if you were to roll an ankle or twist your knee, someone would tell you that you should put some ice on it, lift it in the air, wrap something around it to add that compression, elevate it up, and that's the best thing to do. And that's not entirely untrue. It's just as sports research and physical therapy research goes forward, more musculoskeletal docs, sports medicine docs, physiatrists are leaning towards something else called MEAT. I don't know what it is about the food mnemonics. MEAT stands for movement, exercise, analgesics, and treatment. So the first two are kind of similar, like movement and exercise. Studies have shown that the sooner you can safely get on, say, a turned ankle or a twisted knee and add mobility back to that joint, the quicker it heals. In a similar vein with exercise, sometimes when you twist a knee or you turn an ankle or something like that, the tendon, which has fibers that should be running parallel in it, gets twisted and those fibers get a little bit misaligned. What they've shown in some studies is that certain exercises can help that tendon heal so that those fibers are more aligned and that tendon maintains healthy structure. Analgesics are just pain relief. There's some debate out there as to whether or not you should use anti-inflammatory medications in these kind of injuries. Some people would say that inflammation is part of the healing and using an anti-inflammatory can inhibit that aspect of healing. Others would say it doesn't really make much of a difference. But what is important is that you cut out that pain aspect so that you can do those first two things, movement and exercise. Also, we know the body kind of has a memory for pain and can get into these pain cycles, and so you want to cut pain off pretty quickly. So then the T part, treatment, just pretty much means that if you're going to roll your ankle or sprain a knee or hurt your shoulder or whatever, you should see somebody about that. Now, there's tons of things that can be done to help fix that, and there's tons of types of people you can see. My personal recommendation, of course, is that you at least see a physician, preferably one that specializes in the musculoskeletal system, like me or a sports doc or a physiatrist, to help treat this problem. You can have a whole team of people to help treat it, but at the head of that team probably should be a medical doctor. So the next myth is you have a bone out of place. This myth is something that I hear a lot, and it's also kind of my fault a little bit. I will describe it this way to patients, even though I know it's not true, but sometimes it's an easier way to grasp a technique that I'm doing. You know, you'll hear patients say, yeah, I went to the doctor and they said I had a rib out of place and they had to kind of put that rib back in. That's not really what's happening. Even when people make you pop and crack, that's not what's happening. Again, I'll do a different video on that because I just had an article published in a journal about exactly what you're doing when you're doing these high velocity techniques. But you're not pushing bones back into place. If you had bones that were actually falling out of the joint, that'd be a much more serious problem and you'd probably need to see somebody else about it. And if I really were taking these bones that were falling out of place and throwing them back into place, you could get joint degeneration or you could get arthritis in that joint from the wear and tear of doing that. What's really going on when I say you have like a rib out of place or you have this vertebra out of place is that tensegrity we talked about before is breaking down in that area, and I need to try to restore that so that things work the way they should work, that you don't have a restriction there. So saying a bone's out of place is just one of these things that is a matter of phrasing that doctors have kind of fallen on and other body workers have fallen on because it makes an easy way to explain something, even though it's not true. It's more of a mode of thinking than it is an actual true statement. Stretching is the key to a pain-free lifestyle. Now look, I'm not saying that stretching is bad. I'm going to do a whole video on stretching because it is such a complex topic. But a lot of times I have patients coming in who feel that if they just stretch every part of the body, increase flexibility everywhere, that will lead to being pain-free. That'll take away their back pain, that'll take away their knee pain, shoulder pain, whatever. And that's not entirely the case. You gotta be careful with stretching in the sense that if you overstretch one area and make it too mobile, you can actually cause tightness in another area to compensate. We had that whole talk about tensegrity. I'll link the video up here. But if you mess with one area of the body, you're going to affect another, and making one area too mobile may actually increase your pain and increase your problems. Again, this will be a whole separate video on stretching and different myths within the concept of stretching. For example, we now know it's probably not a great idea to do a lot of static stretching before you're going to exercise. I'll address all that in a different video though, because it would just take too long to do it here. But overall, the myth that just being more flexible in general will make you more pain-free is not entirely true. So the last myth kind of relates to the first myth. I do get patients who come to see me and they say, doctor, all my life I never had this problem, but all of a sudden every time I kind of move my neck around, my joints creak and crack and sometimes pop and click, and I'm worried about that. So the first question that I ask these patients is, does it hurt? That is very important information to me. If it hurts, it might be something like arthritis or bone spurs that are building up in their neck or wherever they're complaining about. If it doesn't hurt though, it's usually not something to worry about. A lot of times these cricks and creaks are just actually tendons and ligaments moving over the surface of your bones. Why is it happening now when it hasn't ever happened before? Well, you're usually in an age now that you never were before, right? As your body changes, as you get older, things kind of shift and move. Things get tighter. Maybe the tendons in that area got tighter. Now there's, moving across bone a little bit more. Who knows? But if it's not hurting you, if it's just the tendons creaking and turning, it's probably nothing to worry about. And most of what I do in that case is give you reassurance. I have heard of other things like certain supplements or drinking lots of water can help with this. That hasn't really panned out. The water thing, if you make a sort of circuitous attempt at explaining it, yes, your joints and your cartilage do require you to be hydrated to be healthy, but it's not like if you're getting cricks and cracks in your neck, drinking a gallon of water is going to make that go away. It's not. But again, it's also usually not something to worry about. That said, the general rule of thumb, if it's something significant enough to make you worry, then it's something worth bringing up with your doctor. So go ahead and ask your doctor about it, have somebody take a look at it, make sure it isn't anything more, but likely it's just the sounds your body is making. All right, guys, that was 5 common musculoskeletal myths. I've got a whole bunch of these, but I don't want to make these videos too long, and if there's anything that you want me to address as a myth that you're aware of or a question you have, go ahead and put it down in the comments, and I'll keep a running list, and we can keep doing this. It might be fun. In the meantime, keep moving.